Good afternoon, everyone. We, of course, are awaiting Governor Edwards' announcement about what Phase 3 looks like. So let's take a listen to what he has to say this afternoon.
And if you look up there, there's a lot of tropical activity. And it seems like the coast of Africa is spitting out one or two storms every day recently. But what I really want to bring everybody's attention to is that red X that's just off of Florida, because since our weather update this morning with the National Weather Service, they have increased the likelihood of development of that storm system into a tropical depression or a tropical storm. And several models have it coming into southeast Louisiana as early as Tuesday or Wednesday of next week. And so this is changing rapidly, as I said, because that's not what they briefed earlier this morning, but I think the 1 o'clock update, they did that. So I'm asking everybody in Louisiana, principally in southeast Louisiana in this instance, to make sure that you're mindful of the weather, that if you haven't done so yet, make sure that you and your family are prepared for a storm. You can go to getAgameplan.org. It will tell you what you need to do to be ready. Being ready in a COVID environment is different than being ready otherwise. So asking everybody to listen to their local officials, pay attention to the weather, and to get a game plan. Today is obviously September the 11th, so I want to take a moment that we can all remember that day 19 years ago. And I'll ask everyone in Louisiana to lift up in prayer the families who lost loved ones on that day, that horrific day, but also the courage of all of the first responders and other people who answered the call of duty. And I would ask people, too, to remember the sense of unity that we had following 9/11 across the country, and we should aspire to regain that sense of unity, but without having to have such a traumatic incident to cause it, because I believe we still share more in common as Americans than that which divides us. So getting to COVID, I know that since my announcement yesterday that we would be moving to Phase 3, that you all and folks across the state have been very interested in what that is going to look like. The new proclamation, which will go into effect tonight, will outline the restrictions that will be in place for Phase 3, and I'll highlight those for you. Restaurants, churches, salons, spas, gyms, other businesses, generally speaking, will be able to open at a maximum of 75% of their occupancy, but with social distancing required. We do know that when it comes to bars, they've been closed for on-premises consumption. We've done what we could to help them to realize some revenue, with 2 of the 3 video poker machines that they have them remaining open, the ability to do drive-through, delivery, curbside pickup, and then the option they have, if they have a kitchen, to get a license to operate as a restaurant and then follow all the restaurant rules. But we know that there's still a number of them that have been closed for on-premises consumption, and that we wanted to provide a responsible framework for them to open as it is safe to do so. And we've been looking at the guidance coming, for example, from the coronavirus task force and so forth. So what I have decided to do is that we're going to have bars remain closed on premises consumptions in parishes with high incidence of COVID-19. And as I mentioned, that's a continued recommendation of the White House Coronavirus Task Force. And especially, you're going to see some slides later that talk about the growth in cases as it relates to different age groups. And I think when you look at the 18 to 24 age group specifically, you're going to see why this is, or at least one of the reasons why this is so important that we make sure that we don't open those for on-premises consumption where you still have a high incidence of COVID-19. But in those parishes with a positivity rate of 5% or lower for 2 consecutive weeks, they may opt in. So the parish government will have to opt in to on-premises consumption of alcohol at bars. And if they do that, the bars will be able to open subject to a number of restrictions. We'll go through those in just a moment. The 2-week percent positivity is updated every 2 weeks by the Department of Health. The next scheduled update is on September the 16th. If and when reopened, pursuant to this order, bars will be able to open at 25% capacity up to 50 people total. Indoors, customers will have to be seated for tableside service only. In addition, they may have no more than 50 customers outdoors. Social distancing is required indoors and outdoors. And again, if outdoors, they have to be seated for tableside service. Live music will continue to not be allowed. All drinks will have to be ordered at the table and delivered by bar staff to the table. Again, patrons must be seated. A sale and service of alcohol at bars, when they reopen, will end at 10 p.m., and patrons will be cleared from the building by 11 p.m. When this happens, those individuals younger than 21 will not be allowed in a bar. So those 18, 19, and 20-year-olds will not be permitted in the bars. For other social gatherings indoors, such as weddings, birthday parties, and the like, they're going to be limited to 50% capacity with a max of 250 people, and obviously the social distancing requirements that go along with that. Outdoor crowd sizes are limited to 50% capacity of the outdoor space up to 250 people if folks are going to be in close proximity and social distancing isn't possible. Casinos will stay at 50% capacity and 75% of the gaming position, so that will not change under the new order. Alcohol sales for on-premise consumption at all of these venues is going to end at 10 p.m. When we go to phase 3. It includes bars, as I just mentioned, but it's also going to include restaurants, event centers, reception halls, and casinos. Sporting events like college, high school football, and so forth will operate at a lesser capacity of 25% with social distancing required and without alcohol sales. The statewide mask mandate remains in place. The order continues to recommend the most basic of all of the CDC recommendations, and that is those at higher risk of severe illness from COVID-19 continue to realize they are safer at home, and they should not go out and certainly should avoid large crowds unless there's some sort of essential activity that they need to engage in, such as getting food or medical care. And this order will be in place for 28 days, expiring on October the 9th. I know that there have been some questions previously about nursing home visitation, what that looks like going forward, and potentially in phase 3. And I want to address that briefly. Nothing at the moment is going to change for nursing home visitations. As you all know, this population continues to be among our most vulnerable and at highest risk for severe outcomes of COVID-19. And like many, many states, somewhere around 40% of all our fatalities have happened in nursing homes. And this is because there's congregant living where people are in close proximity to one another, so the virus, once it gets in, spreads more easily, and those individuals are much more likely to be vulnerable to the disease and have a poor outcome because of age, but also because of the comorbid health conditions. Now, that said, we know that these past several months have been very tough for the loved ones, but also for the residents. And so LDH, in consultation with CMS, and has been working to finalize plans for a pilot program where we're going to try to see if we can allow for some visitation. It'll be for a 28-day pilot program. It's an outdoor visitation program. And similar to the way we're going to do bars, these nursing homes are going to have to be located in parishes with 5% positivity or less and have 0 cases in the last 14 days in order to be qualified to participate. And this is to help minimize the risk for our nursing home residents. LDH will provide additional details in the coming days. And we hope that this pilot is going to be successful and that we can learn. We also hope that there will be more and more areas that get down to 5% or below, and certainly that more and more nursing homes go 14 days without reporting new cases. But this is obviously a very delicate situation, and I can tell you that the folks at the Department of Health are putting forth great effort to make sure that we can do this in a responsible way. I'm going to invite Dr. Bu to come up now and go through some slides that talk about the data that we used to inform the decision about moving to phase 3. And then while he's up here, please ask him any questions about the data or anything else related to health in Louisiana and COVID. So, for example, any questions about the nursing home policy or pilot, I should say, that I just mentioned, or anything else. And then on the backside of that, I'll come back up and wrap up with some updates on Hurricane Laura.
Thank you, Governor. So we'll move to the next slide. So as we normally do when we talk about a gating decision or update on the data, we want to share the data that we're looking at with all of you, so you can see what information we put in front of the governor and some of how he made his decision. So this is again for orientation. When we take a look at the upper left-hand corner, you see COVID-like illness. That's a graph showing people who are presenting to an emergency department with symptoms consistent with COVID, and it's the proportion of those individuals over the total number of people who are going to an emergency department. So it gives us a sense of who's showing up with symptoms that are like COVID when they're coming to an emergency room. Below that, you have the graph with the purple line showing you the volume of testing that's going on across the state, and the orange bar is showing you the percent positivity. That gray line that you may be able to see there at the bottom of the graph, that's 10%. And again, we want as a state to get below that 10% line. We want, as we're seeing the purple line increase or stay stable, we want to see that the orange bars are below that gray line. If we look up at the upper right-hand corner, you see our epi curve, our epidemic curve. These are new cases reported every day. Keep in mind that as we have these backlogs and continue to see backlogs from a variety of different people who are reporting new cases to us late, we as a state, we in the Department of Health, distribute those backlog cases not on the day they were reported, but on the day the specimen was collected. So this accurately represents who showed up on what day to get tested. And what you can see there is the black line is with the average of those incidences over time. And then finally, in the lower panel, the blue line represents hospitalizations for COVID-19 specifically, with the orange line and the slope line that follows it showing you the last 14 days. So we always look at a 14-day period. That's what we've been doing since the beginning of the gating criteria. That was the recommendation given to us by the federal government and the White House. And what you can see is when you look at the COVID-like illness graph, and this is true for every region in the state, COVID-like illness has been on a steady decline, especially since we saw the increase coming out of phase 2. So since the mask mandate, since the closure of bars and the limitation of social gatherings to 50 people or less, COVID-like illness has come down consistently, again, across every region. When we look at the testing graph, what you see there is a lot of the interruption in our testing that happened as a result of first Tropical Storm Marco and then Hurricane Laura. The state, because we needed to redeploy our resources and especially our partners in the National Guard to where they were needed most to protect the public from the imminent threat of a storm, meant that we weren't able to do testing in communities at the level that we might want. And obviously people were thinking about they're getting out of the way of harm rather than getting tested. So you see this decline there that really represents that week of the storms. But then an incline that's coming back. And we've been fortunate because our National Guard is tremendous that they've redeployed almost immediately, and they've got so many fronts that they're working on all at once. One of them is partnering again on getting testing into communities across the state. That being said, we're not seeing that line come up very high as I would like it very quickly. One thing that I do want to make sure that the general public hears is that testing is widely available. I do encourage you to go out and get tested if you are certainly having symptoms of COVID, but also if you've been exposed to someone and are a close contact of someone with COVID. And if you've been evacuated or sheltering because of Hurricane Laura, we do recommend as well, because of the transit and the potential exposures you may not be aware of, that you get a test as well to know your status. This would be a good time to learn your status. What we see on that graph, though, is percent positivity has been steadily declining. Even as tests creep back up, we see that the percent positivity is down. We're at about 6.97% right now, so well below that 10% for the state. When we look at the upper panel, looking at the epi curve, that's new cases, you can see that we've been on a pretty stable decline. Again, that correlates with the mask mandate, the closure of bars, and the restriction of social distancing, or social gatherings rather, to 50 people or less. More recently, there's been a bit of an uptick in the state. And some of that reflects a decrease in testing with a new increase in testing. Some of that reflects, frankly, new cases that we know are evolving, especially in settings like universities and schools. And we'll talk about that in a moment. But not over a 14-day period. So we haven't met that criteria of a 14-day period. And when we look at hospitalizations have been on a steady decline again since those new restrictions. And so, strictly speaking, looking at those data, you've met criteria across those three graphs for movement into phase 3. I want to look specifically, though, at region 1. That's our next graph. This is the greater, oh, sorry, never mind. Let's go back. I thought we had a region 1 graph. Maybe just a point that I'll make then in general about the data that we're seeing. What we communicated to the governor and what the governor talked about yesterday is the data that we don't see up there that we all need to be watching out for. And that's that, again, there was a week that we didn't have visibility because of decreased testing. There's frankly not as much testing as we'd like to see amongst shelterees and evacuees right now. So we don't know if there's been transmission that's happened, and we just aren't catching it because we're not seeing people take advantage of the testing. So again, I would just emphasize, if you're going to a point of distribution, if you're in Region 5 in the Acadiana region, we have testing sites in Lake Charles and in Sulphur. If you're in New Orleans, if you're in Baton Rouge, we have testing that's available for you in hotels. Want to make sure you take advantage of that to know your status, because there's a tremendous amount, or there's a significant amount, I should say, of asymptomatic spread. So you need to know how to protect yourself and your family. So certainly would like to see testing come back up. Something else that we haven't quite seen in this data yet, we haven't had enough time to see what the impact of going back to school and universities will portend. Will show us. And part of the reason is because we interrupted schools, right? People went back home and now they've returned to school. So we expect that that's going to be something we're going to watch very carefully in the data, and I'll show you some data around that soon. So we're not quite sure what the impact of return to school was yet, and that's going to be probably complicated to disentangle, because we know not everybody went back to full in-person. Most people are doing some hybrid of virtual and in-person classes, whether you're in a K through 12 setting or a university setting. And then lastly, what we really don't know yet, because we don't have enough time, is what was the impact of Labor Day? We know that by and large, people did as the governor asked and stayed home, had a staycation, and celebrated with their immediate household. We unfortunately know that some people didn't. And just like Memorial Day, we won't know the impacts of Labor Day until really we're 2 weeks out from that. So those are all trends that we're going to be watching this data very closely on. And hopefully what we find is that everybody, by and large, did what was asked, and that we don't see these either the cases continue to rise or rise more quickly, or the hospitalization trend turn around in the wrong direction. Because as you saw, we've got a very active Atlantic season right now. Atlantic hurricane season right now, and it's not a good time for us to be having multiple fronts in the state facing multiple disasters while we're trying to have while we're having more COVID increase. So I'll flip to the next slide just to show you one of the other trends that we're particularly focused on and concerned about. And we've shown you this before. This is, again, that same data, the epidemic curve. So these are new cases, but it's broken down by age group. So you probably can't see out the top, but orange is under 18, gray is 19 to 29-year-olds, yellow is 30 to 39-year-olds, 40 is 40 to 49-year-olds, blue is 40 to 49-year-olds, green is 50 to 59-year-olds, purple is 60 to 69-year-olds, and then 70 plus is brown. And so what you see is really all of those age groups are tracking together except for the gray, and the gray is the 18 to 29-year-old group. And if we look at the next slide, we've broken out specifically the under 30s here. I won't go through all of the age groups that are depicted here, but I'll just tell you the green line that is taking a sharp uptick is your 18 to 21-year-old age group. So this is an age group that we have a lot of concerns about. This is the group that we know has now gone back to school. And despite things like closure of bars, which helped us turn around the rates of increase case growth that we were seeing during the early phase 2, now with bars closed, we're still seeing that group come up. And that's to be expected. Anytime you bring people together, our best efforts, wearing masks, it's tough when you're bringing large groups together. And so we need to watch that very carefully, especially as we talk about activities that people want to take part in, football, gatherings that happen in the fall, all of those kinds of things. This is an age group that could cause, or that we could see continue to increase. And just as we saw last time, where that age group led, the other age groups followed after that, right? You'll see a report coming out from the CDC soon. I think actually it might have already come out today, talking about infections in child care settings resulting in infections in the households that those children are returning to. So we don't take any age groups increase lightly. So that's something we're going to be watching very closely, and that's part of what shaped the recommendation for the one of the restrictions that's placed on bars that are able to reopen in low incidence communities, that under age 21, we really just don't want you in that setting because you shouldn't be drinking, you're not of age, and it brings you into a setting that's high risk for transmission. So I think next slide. So next slide, this is the summary that we usually show you. This is looking at all of those criteria and looking at all of the regions. Again, as I said, COVID-like illness is decreasing across the state. When we look at cases, though, it's a mixed bag. Here, the red asterisks mean that we're seeing a more recent trend of increase, but it's not meeting that 14-day mark. So it's the most recent trend, but it's not meeting a 14-day mark. Despite that, you see we have several regions where we're starting to see an increase again. I will note Region 5 is a difficult region. That's the Acadiana, that's the Southwest, the Lake Charles and surrounding regions. That's a little bit difficult because all of the numbers in that area plummeted, as you'd expect, because of evacuation. And now as we see testing surge there and people coming back, we would expect to see some increases in that area. But for the rest of the state, these increases are concerning. And when you look at what's going on in hospitalizations, that's going to be a trend that really drives a lot of our concerns. As the governor has said from the beginning, and certainly from the department's standpoint, our biggest concern is being able to have adequate healthcare capacity to meet the needs of Louisiana, not just for COVID, but certainly for COVID and for every other need. So as you start to constrain that capacity through COVID, you have less capacity for heart attacks, strokes, everything else, motor vehicle accidents. So we're watching these trends very carefully. And I think that that's our last slide. So maybe in closing, before your questions, I would just emphasize, as we move into phase 3, and you now have greater capacity in restaurants, in some bars are going to be able to operate under limited service. You have workplaces that you're going to be going to that are now able to operate with a higher capacity limit. It is critical for us to remember that everything that's gotten us to this point still needs to be in place. And by that I mean physical distancing of 6 feet or more is really important. That when we call you and ask if you've been within 6 feet of somebody for greater than 15 minutes, if you've been less than 6 feet from somebody who's a known case for greater than 15 minutes, just because we're in phase 3, that doesn't change that requirement. You are still going to be a potential contact and have to quarantine if you've been in that context, less than 6 feet for greater than 15 minutes. And the most important thing we can do is wear a mask. More and more data shows that wearing a mask, even for people who are shedding the virus, reduces the likelihood that you're spreading that virus to other people. You wear a mask to protect other people around you are wearing masks to protect you. So let's be a good neighbor, and let's continue to wear our masks. So with that, happy to take any questions.
Do you have any idea roughly how many parishes would meet the 5% or less?
So I think when we looked at the data, and I'd want to confirm this, I think that we're looking at probably right now about 5 parishes. 5 out of 64. There's still 64.
Mechanically, is the 2-week period in effect today, so that if I'm less than 5%, I can do this with a restriction, or does it start on the 16th?
So as the governor noted, we're going to be updating. We've already been updating those 2-week lookbacks on an ongoing basis. The next update will be on the 16th. I believe it's active from the past look back.
It's active from a parish opting in. The parish has to be eligible.
Right.
The governing authority has to opt in, and then it's effective.
So for those who can only hear the mic, what the governor was reemphasizing is that first is that, yes, you have to be, over the last 2 checks, the last 2-week checks, so essentially 4 weeks, have been at 5% positivity or less. And then the parish government has to say this is something we want to opt into, because we do understand that this may be a very important local decision that's being made.
And right now, there's only 5. Or approximately.
Right now, I believe that there are 5 parishes that would meet that criterion.
What's the nursing home pilot program look like? Is it just family members going to see their loved ones at an outdoor facility broadly? What does that look like?
Yeah, so similarly, and I'll say, maybe just to give you a longer answer, sorry. What you're going to see us talking about a lot more in the department, now that we have graphs that show us really getting low, is decreasing becomes a little bit less relevant than what's going on in the community. And so percent positivity is really important. What is the level of spread in your community? Because you could be at 1% positivity, and you're going to be seeing an increase up to 2%. That's still a very low risk community, right? Whereas you could be coming down from a higher percentage, and we want to continue to see that improvement. So for nursing home pilot, we're looking at low community spread. So again, we're probably going to be looking at something around the 5% level or less. We want to be in areas where we're not seeing a lot of COVID in the community. And then it's going to be about, again, working with the nursing homes that are in the pilot, establishing protocols where people are outdoors, because that's going to be a safer environment than indoors. We're still going to need to be wearing our personal protective equipment, because that's the way to protect your loved one. And it's going to also have to be a pretty nicely managed visitation, meaning you probably want to know who's coming, when they're coming, and clearly symptoms of COVID or recent COVID illness, being quarantined or isolated for COVID during that period are all going to be reasons you can't come to see your loved one, to protect your loved one. As the governor noted, out of the 5,000 Louisianans that we've lost so far, over 40% of those were from nursing homes. And so as we look at a way to re-engage with those individuals and have families reunited, we need to do that in a way that doesn't put people in harm's way, and not just your loved one, but the loved ones in the rest of the facility. We'll have more details for you on that soon. Okay, thank you.
So just to make sure we were clear with your question, because I was over there with a mask on, a parish has to be eligible, meaning they have to be at or below the 5% threshold for at least 2 weeks. And that's data that's been updated by the Department of Health every 2 weeks for a while. It's publicly available. And then if that parish is eligible, the governing authority has to opt into allowing this. And then if they do, then the system that I described earlier with respect to opening those bars in those parishes to on-premises consumption subject to those restrictions will be in place. What my talking points omitted, and I need to come back and add to that, is if at some point subsequent those bars could be reopened, that gating criteria is going to have to be satisfied again. So,
If you get to 10%, you would have to close as opposed to just over 5%?
correct. Because otherwise you would be opening and closing bars, within a day or two one another, potentially. And so this is the system we've come up with to try to do this safely and responsibly with a good measure of local control over that. Do want to go over today's COVID numbers. You may not have seen them yet. Today, we are reporting 844 new cases, and that is on 27,234 tests. Tragically, we exceeded 5,000 total deaths today, with 41 new deaths being reported, brings us to a total of 5,032. We have 39 fewer people being reported in the hospitals statewide with COVID-19. That total is down to 723, and we have 8 fewer people on mechanical ventilators. That number's down to 117. So as I said yesterday, and as Dr. Bu went over with the 2 weeks of data that we were using to inform our decision, we've had some positive trends that have allowed us to make this move. We do have the concerns about what isn't yet reflected in the data, potentially, which is what I told you, why I told you yesterday that for me, this was the most difficult decision that I had to make with respect to applying the gating criteria to the phasing. So what I want to do is encourage people to really take the mitigation seriously, because reopening more of the economy, reopening our churches to greater occupancy, lifting some of the restrictions, these things really only work if we continue to do, and quite frankly, we need more people to wear their masks. Critically important. Wash your hands frequently. Stay home when you're sick. Social distance from people not in your household. And there's a few other rules that apply. Outdoors, safer than indoors. If you want to support a local restaurant and get a great meal, consider picking it up or having it delivered. Or if there is an option to eat outdoors, eat outdoors. None of that stuff changes as we move into the next phase. Secondly, I want to make sure that people understand that there really isn't a lot of room for movement forward beyond phase 3 until we get past the pandemic, because until such time as social distancing isn't required, then how do you ever go to 100%? And so I'm not saying that there can't be and won't be some adjustments and modifications going forward. But we've gotten into this routine of we went from stay at home to 25%, 25% to 50%, 50% to 75%. We don't go from 75% to 100% until the pandemic is over. And so that's what I need people to understand. With respect to Hurricane Laura, yesterday I had the opportunity to take some members of our state team, including General Waddell, who's here with us today, to visit with elected officials and the directors of the Offices of Emergency Preparedness in Vernon, Allen, and Cameron parishes. Those meetings went extremely well. They were clearly very appreciative of the tremendous effort made by the state government and our federal partners. And I want to say how appreciative I am of all of the efforts that they have been making to partner with us and just the Herculean effort that they are putting forth in order to deliver assistance to their people. We've got tremendous damage and devastation across much of Louisiana. We still have a little over 100,000 customers without electricity. And this is getting more and more focused in that most southwestern portion of our state, Cameron Parish, Calcasieu Parish, and Beauregard Parish. And as that happens, the progress is going to get a little slower because the damage to the infrastructure there was just so much greater. So we need people to continue to be cautious. Heat and humidity will remain a problem. People need to pace themselves, drink water, and be mindful of those heat-related symptoms. We need people to pay attention when it comes to trauma that is induced by cutting trees down or falling off roofs and all of those sorts of things. Running a generator. We still have, like I said, over 100,000 customers without electricity. Generators remain a big part of what's happening in Southwest Louisiana, and that carbon monoxide poisoning is obviously a real threat. So we're asking people to be mindful of that and place their generator at least 20 feet from their home in a well-ventilated area, not under a window or a vent, certainly not in a garage or a crawl space or something like that. Also want you all to know that there have been nearly 3,000 requests for carbon monoxide monitors. The Fire Marshal's Office is working with local officials in the various parishes, and they are making thousands of carbon monoxide detectors available. They're combination fire, smoke alarms, I should say, and carbon monoxide alarms. The National Guard has over 4,900 guardsmen activated. They have distributed almost 6 million liters of water, more than 4.3 million MREs, just shy of 1 million bags of ice, and getting close to 200,000 tarps. They're also today supporting 25 points of distribution in 3 hubs. So that's a total of 28 sites throughout 7 parishes. And I will tell you that we've got tremendous people at the state level doing a lot of work, but everywhere that I have gone, the folks on the ground, everybody from the parish president and the leaders at the police jury to the individuals that I've seen have been nothing but grateful and thankful for the work of our National Guard. I am not objective about this. I will just simply tell you we have the best National Guard in the United States of America. They're the best at preparing for and responding to a disaster. We know that they've been doing great work with respect to the public health emergency as well. And then they have a warfighting mission as well. And they are extremely good at that. So General Waddell, I just want to tell you on behalf of the state of Louisiana how much we appreciate you and your men and women of the Louisiana National Guard, those soldiers and those airmen. Just tremendous. A couple of other points on Laura. As of this morning, we are just shy of 13,000 individuals in our shelters in Louisiana. Almost all of them, just I think maybe 26, were not in non-congregant sheltering. And that was an awkward way to say it. Almost all 13,000 are in the hotel shelters, non-congregant sheltering. We still have about 4,800 in Texas. And what you all need to know is the number of people that we're sheltering is still increasing by smaller numbers, but still increasing thus far every night compared to the night before. Morehouse and Union parishes have been added for DSNAP today. So we announced earlier this week they were approved for individual assistance. They had to request DSNAP. They did so. We then ran that up the flagpole, and they have been approved, and they will be getting information about when DSNAP will start for them. Some tough news for some. FEMA has notified the Louisiana Workforce Commission that the Lost Wages Assistance Program, which is the $300 per week enhanced federal benefit that a number of our citizens have been receiving, is going to end with the week ending September the 5th. And I know that that week has already come and gone, but we're paying benefits 1 week at a time. LWC has received funding, and remember, we're dealing with FEMA on this because unlike traditional unemployment assistance benefits, it's not the U.S. Department of Labor that we're working with. It's actually FEMA. The money is coming out of the Disaster Relief Fund. But The Workforce Commission received funding for the week ending August the 29th today, and they'll be processing those payments immediately. You know that funds don't appear until the next business day, and so those funds should start showing up in people's accounts on Monday. We have requested funding from FEMA for the week that ends September the 5th. We don't yet have it. We will be getting that funding, we've been assured, and as soon as that happens, we will get those payments out as well. And so with that, I'm going to take a little water, and then I'll take your questions. Yes, sir.
With all of these moving parts, is there one area that most concerns you as far as concerns about going backwards? It sort of looks like 18 to 29-year-olds slash bars seem to be pretty high up. I'm not sure what you're about, but just what of all of these components?
Yeah. Well, I guess that's really kind of hard because since the very beginning of this public health emergency, I've been concerned about just about every aspect of it. What I'm concerned most about today on September the 11th is the impact that Labor Day may have. And the reason I say that is we have experience at the beginning of the summer with Memorial Day. And we know that that's when we had a surge in cases driven by the younger population, particularly those in that 18 to 24, 18 to 29-year-old group. It is my hope that behavior was different because everybody went through that process. They saw what it did to our state, and we had all summer to talk about it. The White House was talking about it. Dr. Birx was talking about it. And so I'm hopeful that that doesn't happen to us again. I am relieved that we are getting our testing numbers back up. We're back out with statewide testing, a lot of it done by the National Guard, but we have health clinics and hospitals and other entities that are urgent care clinics and so forth that are doing a lot of testing, and so we're going to be watching very, very closely. But if you just ask me today to pinpoint one thing, it would be the potential for Labor Day to really disrupt the progress that we have been seeing, and the progress that, quite frankly, was shown to you a while ago on those slides that allowed us to go to phase 3. And of course, I'm mindful that yeah, we've started school, and our college campuses have opened to students. The thing there that I take some comfort in is that there's still an awful lot of virtual learning and hybrid learning, and so we don't have many school settings where all the students are present for their instruction. So those are the things that really concern me. I remain optimistic that the people of Louisiana is going to do what's required to protect one another. And make sure that we don't have that big spike. And we will be watching very, very carefully. Yes, sir.
Is there some scenario where those Labor Day numbers come in, I guess this time next week, and they're so bad that you change your mind and revert back to phase 2 prior to the October expiration date?
Well, first of all, there's always whether it's because of Labor Day or anything else, you watch the numbers, and what we are not going to do is put ourselves on a course where we lose the ability to deliver life-saving care in our hospitals. That hasn't happened. It didn't happen, and if you remember back, you had that graph that showed the cases over time and so forth. It didn't happen in the first surge. It didn't happen in the second surge, and I'm not going to let it happen going forward. So, yeah, I mean, that certainly remains possible. Again, I'm hopeful that we're not going to get anywhere close to that, but if we have to, we will. That's what I have said all along. And really, that's why we keep making the point, and we know this. It's not theory anymore. We had that huge surge in March and April, and we were able to flatten the curve through a stay-home order. And so there was this concern that the only way you would be able to reduce your case growth, flatten the curve, and so forth is a stay-home order. But we have shown here in Louisiana and elsewhere you don't have to do that if people will, in fact, wear their masks. and social distance and wash their hands, and you take other strategic actions, you can still leave open a very large part of your economy. You can have your houses of worship open. You can do some of the things, especially outdoors, that you want to do, and have as much normalcy as possible without those cases skyrocketing. But it really is, to a very large extent, up to the people of Louisiana as to whether collectively enough of us will adhere to these mitigation measures that we can be successful. And that's why we keep saying the same thing over and over. And you know, I said a while ago that I have a lot of concerns. Quite frankly, one of the concerns that I have is anytime you announce that you're going to go to the next phase, that people tune out all the talk that Dr. BU gave you and that I've given you, that Dr. Burks has given people and everybody else about how COVID is still here and the essentials remain essential around wearing masks and keeping distance and washing hands and staying home when you're sick and decreasing your activity and protecting the vulnerable. You say all of that stuff, and some people are going to say, well, we're going forward. And that's all that they think about. And that mindset is what can cause us to have real issues too. So we really need people to be mindful, and we're asking local elected officials, business leaders, nonprofit leaders, faith leaders to all set good examples so that we can stay on top of this virus and keep those trends going in the right direction. Any other questions? Yes, sir.
Is phase 3 going to have a big impact on the state workforce compared to the way it's been the last few months?
I'm sorry, say that again.
Will phase 3 have any big impact on the state workforce working remotely versus going to office?
Yeah, well, first of all, with respect to the public sector or the private sector? I'm sorry. All right, I get the question now. Yeah, so Commissioner Darden works with all the agency heads in order to make sure that state employees are working where they can be most efficient and productive, but also in the safest possible way. And so where you have offices, for example, where if you wanted to get to 75%, you can't be at 100%, and so some of those people will probably continue to work at home, and they're going to, he works with agency by agency because not every situation is the same. Some agencies work in office buildings that are more or less traditional and with cubicles and so forth, and it is harder to safely work in that environment than it is elsewhere. You know, for example, people that might work with wildlife and fisheries, they're out in a boat checking on people who are teal hunting this weekend. So that's one of the safest things that you can be doing. So those individuals obviously can't do that and work from home, but they also don't need to work from home. But they do need to have their mask on when they go and ask that hunter for a license. Any other questions? Well, look, thank you all for continuing to cover this. I do kind of want to finish where I started. If you look from the Gulf of Mexico to the west coast of Africa, you're going to see a number of storm systems, most of which pose no threat to Louisiana. But the one just off of Florida does, and it's too soon to know what the ones just off the coast of Africa will do. But we do know we have to be prepared. It will be very, very difficult for our state if we have to go through another hurricane or significant storm in our present posture where we have people who are already sheltered from the last storm. And we're still trying to recover from the power outages and everything else. So let's all lift one another up in prayer. Let's be good neighbors. Let's do what's required of us, both as it relates to the weather and to COVID-19 in order to take care of ourselves and our families and one another. With that, I think we will have our next appearance with you all on Monday, and we'll certainly let you know what time that's going to be, unless, Shauna, we want to do that now?
Yeah, in the afternoon.
Okay, so it'll be Monday afternoon. Thank you all. God bless. Have a great weekend.
You were listening to Governor John Bel Edwards there. In case you're just joining us, we are interrupting regular programming because he had an update on the coronavirus response. And his goal in this press conference was really to make more clear what phase 3 reopening is going to look like in Louisiana. Well, after that press conference, what is certain is that it's still not exactly crystal clear. One of the major things that Governor Edwards said today is that businesses will be able to open at 75% capacity. Many businesses, not all of them, of course, many businesses, restaurants, churches, salons, gyms, many government offices, things like that, buildings that contain offices will be able to work at 75% capacity. Now, the thing with that is people still have to practice social distancing and they still have to wear their masks. That statewide mask mandate remains in effect. Governor Edwards even said this afternoon that Louisiana has proved by flattening the last curve and the last spike that we had that was at the beginning of the summer, by staying open somewhat and using those preventative measures, we have shown that it's possible to do that and continue operating some of these businesses. So he's hoping that people will continue to wear the masks, will continue to wash their hands a lot, will continue to practice social distancing and maintain that distance between people, ordering out from restaurants when you can, not having gatherings that are too large. Now, something that is also unclear in this latest announcement is what's happening with the bars. Governor Edwards says that the bars who have remained in parishes and areas that have remained below a 5% positive rate for 2 weeks may be able to open if the local leadership in those parishes signs off on it. Now, those bars will also have to open at a diminished capacity, 25%, only up to 50 people indoors, he said. Those bars in those areas where they've gotten the go-ahead from the government and they have been below 5% positivity, those bars can open. Now, it sounds like not very many places in Louisiana are actually eligible for that at this point. And, of course, Mayor LaToya Cantrell here in New Orleans has made it clear that we are remaining in phase 2 restrictions until kids get back to school and we find out what's going to happen with them. So New Orleans, obviously not among the parishes in the state where bars can be reopened. Another key announcement today from Governor Edwards was about nursing homes. And we know so many people out there have loved ones in nursing homes, are just really wanting to see the loved ones that are in those homes. They've been isolated for 6 months. Well, the governor said that they're working on a plan to allow visitation outdoors in some of those same areas where they have a lower positivity. So those are some of the key takeaways from the governor's press conference today. One thing that he did emphasize, there is a system of thunderstorms that's off the coast of Florida that could impact Louisiana as early next week. And of course, our meteorologists will have the very latest on that and all of these new announcements on phase 3 coming up on the Eyewitness News tonight at 5 o'clock. So until then, we'll send you back to regular programming, and I will see you for the Eyewitness News at 5.
Our most talked about guests.
What would your guess be if we'd be together today or not?
I would have given it about a -2.
Are back.
If he didn't change, he was going to die.
All new Dr. Phil.
Today at 4 on Channel 4.
I meet people on the street all the time, and they ask me, how do you help injured people? Well, the answer is, from the moment you call, we fight hard to get you every dollar you deserve. So if you've been injured in a car wreck, call me now.